Vaccin COVID-19 sa yo, c'est une solution importante pour protéger tête tout et puis pour mettre fin à la pandémie ça.
Mais, ou capable de question sur sécurité vaccin.
Ces mêmes mesures sécurité ont été utilisées pour tout l'autre vaccin. C'est yo tout qui ont été suivi pour vaccin COVID-19.
Il y a des dizaines de milliers de monde qui ont participé dans l'essai vaccin COVID-19 ça yo, et le résultat a prouvé que yo sain et sauf.
Depuis les sato, il y a plusieurs millions de monde, différentes races et ethnicités qui prennent vaccin. Et puis c'est un petit malaise tout petit yo te gagné.
Moi te prends vaccin pour me protéger tête moi, famille et patient yo.
Les tout pour l'arrivée, pas hésiter. Fais la médecine confiance. Prends vaccin.
I'm welcoming viewers around the world, viewers in Massachusetts, and viewers all over the social media. My name is Ronald Bernard, and I am presenting this series called Dialogue with the Candidate. Dialogue with the Candidate is the show that MCTV is bringing to you to know people who are running for office, their agenda, what they plan to do, and how you can support their ideas. Today I am honored to have with me Ms. Katrina Huff-Larmond.
Yes, thank you.
Thank you for accepting, to come to our platform. And Katrina is running for Senate, so State Senate.
Yes.
And how about you introduce yourself and let the audience know who you are and why you're running for State Senate?
Thank you, Ronald. First of all, thank you for the invitation. It's always a pleasure to come and have the opportunity to talk to the community and talk to you. So I'm so appreciative of the invitation. But yes, Katrina Huff-Larmond, running for State Senate. I feel like I have that part down. Like I wake up and I say, hi, my name's Katrina Huff-Larmond. I'm running for State Senate in District 34, which is a new district. Currently, I am a Randolph Town Councilor, and I've been a Randolph Town Councilor since 2016. So I've been around a little bit. I've definitely had that experience of governing a body of individuals in a town. And so when I decided that State Senate is something is a position that I want to run for, I definitely looked at my background and say, you know what, Katrina, you have done this work. You will continue to do this work, but more on a policy level and statewide, because we need it. We're needed everywhere. We need women of color, people of color are needed on the local level, the state level, the federal level, and currently there's not much representation on any of those levels.
Okay. And so now you mentioned it's a new district. So
Yes.
talk to us about the new district.
I am so excited about this district. I'm excited because this is a majority minority district. That's what it's called. It's a district that was designed to make sure that there was equity and equality, giving opportunities for individuals who are interested in running to have the confidence to run. For many years, the same individuals have been running for these different seats, and other people have not felt as if they had the same opportunities. So majority minority district was developed to make sure that people felt felt as if they could run for Senate, state rep, even local government, especially federal government, and actually win. So it's just another tool to help balance out equity. And I'm really excited about this because I helped develop this district. I worked with the Unity Table, ACLU, and other organizations came together to make sure that there was an equitable district where other people feel confident about running and actually have the opportunity to run if this is something they want to do. So we're just trying to take at least one barrier out of the way so others are able to go forward and have their voices heard.
Okay, when I'm looking at the map, you could see I see Avon, Brockton, Wheatham, and there are many other places I see. So what are things that they're facing, like in terms of issues that you're going to work on a policy level to tackle based on your campaign?
Right. So the district consists of Randolph, Avon, Brockton, Whitman, Hanson, Halifax, and East Bridgewater. And although there are some universal issues, definitely some universal issues that just as Americans and outside of America that everyone's dealing with, there's also a balance that needs to happen within the different districts. But it's important to focus on all of these districts. So one issue I've been really focusing on is mental health. And that's universal, that's global. We really have to start looking at policies around mental health. There are policies, but what I've started doing, I started combing through the mental health policy to see where the gaps are. Because currently we still do not have the resources that we need. Currently we still do not have the treatment that is needed, especially for youth. More youth are committing suicide. What is going on when we have the majority, not the majority, but an increase of our youth committing suicide? 80% of individuals who commit suicide have been diagnosed with some sort of mental health issue. So I'm combing through the policies to look at where the gaps are. And where I do definitely see a gap is insurance.
Okay. So with the mental health you mentioned about, we could see during COVID, it's like personally I saw like some friends went through tough time, and the mental health, it's like it has been exploded at this time.
Absolutely.
And people could see either loved ones. We see many either divorces or many things happen.
Absolutely.
Challenging time. But when we look at what's going on in our country, I mean in the United States, based on different circumstances, things that happen in the school and mental health, we cannot say we're not doctors. We cannot diagnose say it's mental health, but how you plan in terms of your experience to help, especially the youth in that district, to finding services that can help them if they are suffering any mental health?
Well, first, it's just being knowledgeable. We have not been really educated about mental health because we are still afraid of it. It's still this taboo. People don't want to talk about mental health. So we have to make mental health known that this is a society issue. It's not an individual issue. Because you have a mental health issue and you have a mental health issue. It's not about the individual. It's about the public, society coming together and recognizing that together we need to put together resources and really focus on how to heal our community.
Okay.
And as soon as we start looking at it as a public issue and not an individual issue, people will feel more comfortable in putting more energy, treatment, money in that goal, because that's what's needed. More attention, more education. And once we have more education and more resources, we'll be able to help the youth. We'll be able to help the older adults. We'll be able to help the middle adults, the emerging adults. We have a group of individuals who are suffering from mental health on different human behavior levels, and they need different type of treatments.
Yeah, definitely.
And so that needs to be seen as a global issue and not an individual issue. And that's what I want to bring to the table. I want to bring individuals who are struggling, individuals who are having difficulty, and I want them to speak and say, this is what I need.
Yeah.
These are my issues, and this is what I need. I just want to be that vessel.
Yeah, definitely.
But I want people to come be, to use me. I really want to really bring people with me and hope that there's a seat next to me. And I know I'm unable to do that, but I definitely want to be used to make sure that the issues that are in our community, in the district, and beyond the district are being heard from those who are suffering from some of these situations. Affordable housing is another situation that I'm very passionate about, trying to figure out. Homelessness, affordable housing, environmental justice is definitely another issue that have surfaced for me. Many people, when they think about environmental justice, they think about pollution, which is definitely on the table. But there are also so many different layers of understanding environmental justice and racism, classism, understanding how economics is also part of that.
Yeah.
And lastly, well, not lastly, but another one I'll throw out is gun control. Just last week, I was able to collaborate with the Randolph DEI Coalition, the Diversity, Equity, and Inclusion Coalition, and we were able, in 4 days, put together a rally in the center of Randolph, just to have a peaceful conversation about gun control and how it's affecting communities, how it's affecting our youth, our babies are being affected by, the use of lack of policies around gun control. So these are all situations that I want to tackle and make sure that we have the best policies possible in place, because policies are supposed to protect the people.
Yeah.
And so it's important for us to make sure we're protecting all people, not just a certain group of people.
Definitely. So all the viewers, you are still listening to Dialogue with the Candidate on MCTV. My name is Ronald, and I am the host for the show. So we continue the dialogue with Katrina Huff-Larmond. We're talking about her vision as she's running for state senate. So, Katrina, what is the job of being a state senate consists of?
Legislation and making sure that there are policies that are that are governed to help people within your district, but I say beyond the district as well.
Okay.
But policies in place that will help the district and the state run smoothly and able to gain access, able to gain treatment, able to gain opportunities to grow around economics. We have, Chapter 90s money, Chapter 70s money. We have to think about the schools and how the schools are the needs of the schools. Mm-hmm. We have to think about the needs of each community. What does the community need from, infrastructure, building in the community, to individuals in the community and how they could live a healthy lifestyle.
Okay.
Everyone doesn't have the same opportunities or the same benefits, but each community, each town and city that's represented in District 34 should have the same opportunity to grow, the same opportunity for each resident to feel as they are being paid attention to, and that the government is interested in them building a bigger and better town and or city.
Okay. As we're talking about the campaign, so far, have you enjoyed the journey, your campaign?
I have.
Okay.
No, I've had, my parents have always called me chatty. So I've had an opportunity to talk to a number of residents in each town and city that is represented by District 34, especially gathering signatures. I've been at grocery stores, I've been door knocking, I've been to caucuses, fundraising, small house parties, and it's all been enjoyable. It's enjoyable because I get to meet the people. Yeah. Meeting the people is number one. Once you meet the people, you understand who's in the district, then you could cater to their needs. Definitely. Because that's how I see myself, as a servant, to cater to the needs of those who are in the district. Gathering signatures, 300 signatures we needed to get on the ballot. We collected almost 600 signatures that were valid. So we received signatures, we talked to people. I'm excited to hear, not everyone loves Katrina Huff-Larmond, but that's okay. I'm still excited to hear what you have to say and how I could be a servant to make sure that the town and or city that you live in is providing you everything that you need.
Let's say you be elected. Yes. And what would, let's say, the residents in District 34 should expect, let's say, 100 days, or what should they expect from your, administration?
The first thing I think they should expect is for me to listen. I've already held office hours in every town and city that is part of District 34. That means that I've gone to every library and have sat there for an hour or so, just waiting for individuals, residents to approach me and have a conversation about what are your needs. So I want to be accessible. I don't want to just sit at the table and go along with the situation. For some people, that might be okay. I'm a doer.
Okay.
So I want to go to each town, each city, and do the job. So to listen, office hours, and to understand the need of each town, because the needs are different. And Brockton and Randolph may have different needs than in Halifax and Whitman. So I want to listen to what the needs are in each town and how I could fulfill those needs. I've already heard in Brockton, a mother approached me and spoke about the homelessness in Brockton and the need to make sure we are focused on that. And that is something that people want to know more about. And compared to when I went to Halifax and an individual came up to me and spoke about the elderly and insurance, mm-hmm. and how insurance that's in place now has not been beneficial to some individuals depending on the income that you bring into the home today. So many of this is universal. However, the needs in each town is a little different. Yep. Especially when it came to COVID, I will say. And many towns, but not only COVID, but, also receiving state money. There's always a formula. How much money should mm-hmm. this town receive? How much money should that city receive? And I think it's important to look at the formula. For instance, what we found out around COVID mm-hmm. Was the formula was keeping us from receiving the resources that we needed. Randolph is a majority minority town. So when COVID first came out, we knew who was suffering from COVID. Mm-hmm. The majority were folks of color that were suffering from COVID. But yet we did not have a testing center. We did not have the needs or the resources, although we're a majority minority town. So it took lots of effort from the town, lots of effort from myself, from the town manager, from the late Ken Clifton, to do work around making sure that Randolph had the proper resources to combat COVID. And we figured out that because of the formula, we don't have a large number of folks, so they didn't think we were as needy. But the majority of folks in our town are people of color.
Yes.
So we're more needy with 34,000 residents than a town that has not many folks of color, but may have 50 or 60 or 70,000 individuals in their city.
Okay.
So looking at that formula is really important about where's the money going, and how it's being spent, and how is it being looked at when it's being distributed.
Yes, as you mentioned, like during COVID, we know that small businesses have been, hit very hard. So in District 34, do you have any plan, anything in mind, how you're going to help small businesses to survive?
I am coming up with this plan. I'm going to first test it out in Randolph. If I get everything that I need, I have realized that small businesses have not been successful through COVID. Women-owned, businesses of color, but small businesses, period, have not done well during COVID. So what I think is important is for the state to see how they could take over that responsibility. So in Randolph, we are asking to use some of our ARPA money towards small businesses. And so currently, I haven't had the subcommittee meeting yet, but I'll tell you what I want to do.
Okay.
I want to talk in that subcommittee meeting. Each counselor is assigned to a subcommittee, and the subcommittee that I am assigned to is small businesses here in Randolph. So I want to talk about how we could help the small businesses, how we could maybe have either a loan program or some sort of revolving fund for current small businesses that are having difficulties, or maybe even startup businesses, and making sure they have the resources to be successful, that the paperwork is together, and there's actually an organization or an individual that can help them when in need, so their business will grow. So I want to definitely focus on small businesses and make sure they have these opportunities to start, to grow, and to maintain. We need businesses in our communities in order for the town or city to grow.
Yes.
We need commercial property. So it's important that we have small businesses, and important that we have the residential and the small businesses. We want make sure we have commercial property, and commercial property is paying taxes, that will help balance some of the tax situation in each town and each city. So small businesses are definitely on my radar on attacking how to improve the current situation in each small business, and also those who are interested in starting a small business.
Small business. Yeah, I like the idea when you share about each cities, they have different needs.
Yes.
And I assume your approach would be a comprehensive approach to help the resident of those cities to improve their circumstances, improve the situation, or whatever they are going through in terms of surviving and doing COVID and small business as well. So what you would like to say to people from District 34 who are listening to you right now and why they should trust you?
Well, I would like to say to those in District 34, again, my name is Katrina Huff-Larmond. I'm running for State Senate in District 34. I am here for the people. I mentioned before, I am a doer. I'm not an individual who's interested in just sitting at the table. I haven't done it as, I haven't just sat at the table as a Randolph Town Councilor, and I do not plan to just sit at the table as a state senator. I want to understand the needs. I know what many of the needs are. Myself as a clinical social worker and a professor, I have worked with individuals who are suffering from mental health, who have housing issues, who are homeless, early childhood education, environmental justice. I have taken all of these issues from one way or another and have researched the issues or have dealt with them, if not directly, indirectly. And I want to bring individuals to the table with me. So when we talk about a number of different issues, I want individuals sitting with me and using me as an individual who could get your voices heard, where you could also have a seat at the table. I understand the importance of sitting at the table. I understand the importance of being heard. And so if I could be that person to be used so others could be heard or others could sit at the table with me, I would actually push my seat back so others could sit there in front of me, because that's what's important for people to be seen and recognized. So that's my goal. That's what I want to do. I want to look at policies, but I want to look at policies that are going to be helpful for the people when we are working our day-to-day lives, and to grow communities, to beautify communities, looking at paving, looking at infrastructure. There's so much that happens at this level as State Senate, and it's important for people to know and for people to be part of these discussions. Thank you.
Well, thank you, Katrina, and it's a pleasure to have you on MCTV platform. And all the viewers, you've been listening to Dialogue with the Candidate, and I'm the host, Ronald Bernard, who is presenting the show. Thank you, Catherine.
Vaccin COVID-19 sa yo, c'est une solution importante pour protéger tête et puis pour mettre fin à la pandémie ça.
Mais, ou capable de question sur sécurité vaccin.
Se même mesure sécurité yo te utilisé pour tout l'autre vaccin yo. Se yo tout yo te suivre pour vaccin COVID-19 yo.
Il y a des dizaines de milliers de monde qui ont participé dans l'essai vaccin COVID-19 sa yo, et le résultat a prouvé que yo sain et sauf.
Depuis les sato, il y a plusieurs millions de monde, différentes races et ethnicités qui prennent vaccin. Et puis c'est un petit malaise tout petit yo te gagné.
Moi te prends vaccin pour me protéger tête moi, famille et patient yo.
Les tout pour l'arrivée, pas hésiter. Fais la médecine confiance. Prends vaccin.